Hey, Health Protocol family. If you're dealing with knee pain, understanding inflammation is key. Inflammation is your body's natural and necessary response to injury. It's how your body sends healing substances to the damaged area. However, if an injury doesn't heal properly, or if the inflammation doesn't subside, it can become long-lasting or chronic. This chronic inflammation can then lead to a vicious cycle. More inflammation causes more injury, which causes more inflammation, resulting in knee pain that lingers or gets worse. You feel that nagging ache, that sharp twinge, or even a deep, throbbing pain in your knee that just won't quit. You're definitely not alone. Knee pain is one of the most common reasons people seek medical help, affecting a whopping 1 in 4 adults. Whether it's a sudden injury, years of wear and tear, or an underlying condition like arthritis, knee pain can seriously put a damper on your daily life. Today, we're diving deep into the complexities of your knees. We'll explore what makes this crucial joint tick, uncover the common culprits behind knee pain, and most importantly, equip you with the knowledge to understand, manage, and even prevent discomfort. Get ready to give your knees the attention they deserve. Knee pain isn't just a minor disorder. It's the leading muscular and joint complaint that sends people to the doctor. It can range from a slight discomfort to intense pain that makes every movement a struggle. This pain can stem from various sources: a sudden injury, repetitive stress from overuse, or underlying medical conditions like different types of arthritis. While sometimes you can manage it with simple self-care, other times it calls for professional medical intervention, including physical therapy, medications, or even surgery. Your knee joint is far more than a simple hinge. Its primary job is to bend, straighten, and bear the weight of your entire body in harmony with your hips and ankles. But it also has the amazing ability to twist and rotate. To perform these complex movements while supporting your body, the knee relies on an intricate network of specialized structures: bones, ligaments, tendons, and cartilage. Bones of the knee, 4 bones, come together to form the knee joint. The femur, thigh bone. This is the large bone forming the top part of the joint. The tibia, shin bone. Located in your lower leg, the tibia is the main, weight-bearing bone at the bottom of the joint. The patella, kneecap. This small, triangular bone glides along the front of your femur, protecting the joint. The fibula. The other bone in your calf, the fibula, doesn't bear much weight but is crucial for providing attachment points for ligaments that stabilize your knee. Ligaments. Ligaments are tough, fibrous bands that act like strong ropes, connecting bones to other bones. Your knee boasts 4 crucial ligaments that work together to provide stability: the anterior cruciate ligament, ACL, and posterior cruciate ligament, PCL. These cruciate, or cross, ligaments are inside the knee joint. They provide critical stability, preventing your tibia from sliding too far forward or backward under your femur, and also help control rotational movements. The medial collateral ligament, MCL, and lateral collateral ligament, LCL, situated along the inner, medial, and outer, lateral sides of your knee. These collateral ligaments prevent your knee from bending too far sideways, giving it crucial stability from side to side. Tendons. Similar to ligaments, tendons are also strong, fiber-like bands. However, their job is different. They connect your muscles to your bones. The quadriceps tendon. This vital tendon connects your large quadriceps muscle on the front of your thigh directly to your kneecap. The patellar tendon. This tendon then connects your kneecap to your tibia. While technically a ligament because it connects 2 bones, it functions as part of the extensor mechanism. The extensor mechanism. Together, the quadriceps muscles, quadriceps tendon, and patellar tendon form what's called the extensor mechanism. This powerful unit is what allows you to straighten or extend your leg. If you have knee pain, especially from a recent injury or flare-up. Some of the most effective things you can do at home to help break that inflammatory cycle fall under the acronym PRICE: protection, rest, ice, compression, and elevation. Protect the knee from further injury. This is foundational. You can achieve protection by using knee pads or splints for specific activities. For example, wearing a pad over your kneecap can be very effective for conditions like housemaid's knee, prepatellar bursitis, by preventing repeated trauma. Giving your knee a break from activities that cause pain or discomfort is crucial. Rest reduces the strain from repetitive movements, allowing your knee time to heal properly and preventing additional damage. Icing is a go-to strategy for reducing swelling and numbing pain. It's beneficial for both acute, sudden injuries and long-term inflammatory conditions. Most experts recommend icing your knee 2 to 3 times a day for 20 to 30 minutes each session. You can use a dedicated ice pack or even a simple bag of frozen vegetables, whatever works. Applying gentle, even pressure with an elastic bandage, like an ACE wrap, can help reduce swelling and provide support. Make sure it's snug, but not too tight, as you don't want to cut off circulation. When you're resting, try to elevate your knee above the level of your heart. This uses gravity to help drain excess fluid away from the joint, further reducing swelling. It's fascinating how our bodies are wired. The nerves that provide sensation to your knee also extend to your hips, legs, and ankles. This means that sometimes knee pain can actually be referred pain that originates from an issue in your hip, ankle, or even your lower back, but you feel it in your knee. For our discussion today, however, we'll focus on pain that truly originates from the knee joint itself. Generally, knee pain falls into 2 main categories: immediate, acute, or long-term, chronic. Acute pain usually strikes suddenly, often due to an injury or infection. Chronic knee pain, on the other hand, typically develops over time and is frequently linked to ongoing injuries or inflammatory conditions like arthritis, though persistent infections can also be a cause. Acute knee pain, sudden strikes. Sudden knee pain can be sharp, intense, and often signals an immediate problem. Here are some common causes: sprained and torn cruciate ligaments, ACL, PCL. Description: an anterior cruciate ligament, ACL. Injury is a notorious sports injury, often caused by abrupt stops or violent twisting motions of the knee. The posterior cruciate ligament, PCL, is much stronger and less commonly torn. PCL injuries typically result from severe direct blows to the knee, like hitting your knee on a dashboard during a car accident, and often occur alongside other injuries. If you tear your ACL, you might hear a distinct pop sound. Your knee will likely feel unstable or give way, and the pain can be so severe it might make you feel nauseous. Significant swelling almost always follows within hours because the ACL bleeds a lot when torn. For high-level athletes aiming for peak performance, surgery is often recommended. For others, conservative treatment with physical therapy and a knee brace might be sufficient. Tendon ruptures. Description: the 2 major tendons in your knee, the quadriceps tendon and the patellar tendon, can partially or completely tear. Quadriceps tendon ruptures are more common in recreational athletes over 40, while patellar tendon ruptures often affect younger individuals, especially those with a history of tendinitis or steroid injections in the knee. A rupture in either tendon causes intense pain, particularly when you try to kick or straighten your leg. A complete rupture means you won't be able to straighten your knee at all, and your kneecap will likely be displaced, either too high, patellar tendon rupture, or too low, quadriceps tendon rupture. Immediate medical attention is crucial, and surgery is usually required for a complete tendon rupture. Partial ruptures might be managed with splinting alone. Knee dislocation. Description: This is a severe medical emergency caused by a powerful blow to the knee. A knee dislocation means your lower leg bones are out of alignment with your upper leg. This extreme force not only stretches and often tears ligaments, but can also damage crucial arteries and/or nerves. An arterial injury is especially critical as it can cut off blood supply to your lower leg, potentially leading to amputation if not restored quickly. Nerve injuries can result in weakness or loss of sensation in the lower leg. Knee dislocations are extremely painful and make your knee look visibly deformed. Sometimes, the knee will spontaneously realign itself, called a reduction, which you might feel as a dull clunk. If a knee dislocation hasn't realigned on its own, a doctor will perform an immediate reduction. However, treatment doesn't stop there. Whether it reduces on its own or is reset in the hospital, further medical care is essential. Doctors will typically observe you in the hospital and perform tests to rule out any artery or nerve injury, which, if present, requires immediate surgical repair. Knee osteoarthritis, OA. Often called wear and tear arthritis, OA is caused by the gradual breakdown of the smooth cartilage, meniscus, that cushions your knee bones. In severe cases, this cartilage completely wears away, leading to painful bone-on-bone rubbing between your femur and tibia. Knee osteoarthritis causes constant knee pain that frequently worsens with movement or activity. Treatment focuses on pain control, anti-inflammatory medications, over-the-counter or prescription, can help. Injections of hyaluronic acid, a lubricating gel, can provide relief for a year or more. For severe OA, doctors might consider stronger pain medicines or, in advanced cases, knee replacement surgery, where a synthetic joint replaces your damaged knee. Physical therapy is also crucial for managing pain and improving knee function. Rheumatoid arthritis, RA, of the knee. RA is a chronic autoimmune disease that affects your entire body, including many joints, not just the knee. It causes the body's immune system to mistakenly attack its own joint tissues. In addition to knee pain, RA often causes significant morning stiffness and pain in other joints throughout the body. Treatment involves pain management, anti-inflammatory medications, and specialized prescription drugs aimed at slowing the disease's progression. Bursitis. This condition occurs when the bursae, small, fluid-filled sacs that cushion bones, tendons, and muscles near your joints, become inflamed. It can be triggered by injury, infection, or crystalline deposits. Bursitis leads to a painful, often swollen knee. A common type is prepatellar bursitis, frequently seen in people who spend a lot of time on their knees, sometimes called housemaid's knee or carpet layer's knee. Another type, anserine bursitis, causes pain about 2 inches below the knee on the inner side, often worsening with knee bending or at night. This type is more common in women and those carrying extra weight. Treatment typically involves home care using the Price therapy, protection, rest, ice, compression, elevation, and NSAIDs, non-steroidal anti-inflammatory drugs. More severe cases might require steroid injections from a doctor. Knee pain prevention. Knee pain has a vast array of causes, and while some are difficult to prevent entirely, there are many proactive steps you can take to significantly reduce your chances of a knee injury and maintain healthy knees for years to come. Avoid excess weight. This is perhaps one of the most impactful prevention strategies. Avoiding weight gain or shedding extra pounds dramatically reduces the sheer force placed on your knee joints, not only during strenuous activities like athletics, but even during everyday walking. Think about it. Every extra pound you carry translates to several pounds of pressure on your knees with each step. Medical research also suggests that maintaining a healthy weight can reduce the risk and progression of osteoarthritis. For similar reasons, keeping your weight down can also significantly reduce the likelihood of ligament and tendon injuries by decreasing the overall stress on these vital structures. Keep limber. Keep fit. Many common knee problems are actually rooted in tight or imbalanced muscles surrounding the joint. For this very reason, regular stretching and strengthening exercises are incredibly effective at preventing knee pain. Stretching helps to keep your knee joint flexible and prevents the muscles and ligaments around it from becoming too tight. This is particularly beneficial in preventing conditions like patellofemoral syndrome, runner's knee, and iliotibial band syndrome. Strengthening exercises, especially those targeting your quadriceps, the muscles on the front of your thigh, such as straight leg raises and leg extensions, are vital. Strong quadriceps provide crucial support and stability to the kneecap and the entire knee joint, protecting it from undue stress and injury. Don't forget to balance this with hamstring and glute strengthening as well. What was the most surprising thing you learned about knee pain today? Share your thoughts and experiences in the comments below. And if you found this information helpful, please hit that like button, subscribe to Health Protocol, and ring the notification bell so you don't miss our next essential health guide.